A sudden outbreak of conjunctivitis has been witnessed in Delhi after the national capital faced floods and disruptions due to heavy rain. In fact, even Gujarat and Arunachal Pradesh are reporting higher than usual cases of conjunctivitis.
Now, Pune has reported 2,300 cases of conjunctivitis within a matter of just 5 days, and cases are being reported in higher numbers from areas that are located on the banks of the Yamuna River after the flood water receded.
In fact, we've seen a case rise as far as conjunctivitis is concerned in Delhi, in Gujarat, in Maharashtra, as well as some northeastern states. Vadodara and Gujarat reports around 500 cases of conjunctivitis daily, while Pune, as Divya mentioned, reported 2,300 cases of conjunctivitis within a span of 5 days.
Now, 10 to 12 students are being sent home daily due to the eye flu in the Delhi schools, and the outbreak of this viral conjunctivitis is higher than previous years. The Centre for Sight has gone on to say that they're seeing a rise as far as cases are concerned of at least 20 to 25% as far as the infection this year is concerned. Now, joining us on the broadcast is Dr. Naveen Sakuja, Senior Consultant and Ophthalmologist. We also have Dr. Sunil Raina, Community Health Expert and Expert. This is Disease Prevention and Management. And also joining us on the broadcast is Dr. Neeta Sethi, Director and HOD of Ophthalmology, Fortis, Gurugram.
In fact, let's take our first question to Dr. Sethi. Dr. Sethi, now the number of cases in Delhi, many health experts and doctors are saying, has been 3 to 4 times more than it was last year around the same time. In fact, some doctors in Noida also saying that they're treating around 80 patients a day for conjunctivitis. It seems this year's conjunctivitis outbreak is significantly worse than last year's, at least in the NCR region.
Yeah, absolutely. It's much worse as far as numbers go. Also, the conjunctivitis this year is much more severe. Patients are coming in, earlier it used to be redness in one eye and then maybe after a few days the other eye. We're getting patients coming in with pain, redness, swelling, both eyes, very, very severe symptoms, and also extremely contagious. If there is one person in the house, the whole household is going to get it. So yes, there's an increase in numbers, increase in severity, and it's lasting longer also. So definitely this year, it's a much worse outbreak of conjunctivitis.
We also have Dr. Sakuja joining us. Dr. Sakuja, is humidity driving the spike in cases this time around because it has rained a lot more than usual? What are the causes of conjunctivitis and what is the treatment for conjunctivitis? More importantly, how does it spread?
That's a lot of questions. So I think, yes, for certain, there's more incidence of conjunctivitis this year. I'm fully in agreement with Anita that there is a higher amount. I think that one of the contributory causes is the flood that has happened in both the places, and that's a commonality here as well as in Gujarat. Also, there's much more humidity. It has been raining a lot for the last several months. This virus is primarily caused, conjunctivitis is primarily caused by a virus called the adenovirus. It comes every couple of years. It originally started, if you remember, during the Bangladesh war. It was called Jai Bangla in those days. So the adenoviral conjunctivitis is highly, highly infectious. As Dr. Neeta said, if one person in the family gets it, the chance of spread to the other members is very high. Spread happens by touch. It does not happen by looking at people who have conjunctivitis. So basically, you touch a table and then somebody else in the house touches the table and decides to touch their eye after that. It would instantly reach their eye. For that reason, the sort of the weak link in the transmission of the chain for the virus is, excuse me, wash your hands as frequently as you can, both the patient as well as the other people in the house. Thereby, you break the transmission of the virus from the eye to whatever material you are touching. Secondly, don't touch your eye. And the last question you asked was about how to treat it. Now, essentially, the treatment is going to be palliative, symptomatic, really. That means in layman terms. Symptomatic means if you have got red eye, painful eye, watery eye, you'll have to be supplemented with lubricants and so on. Antibiotics are given, but antibiotics are given as a kind of as a cover to prevent other bacterial superadded infection, which inevitably takes place in a viral conjunctivitis. It's going to run its course. It will take 7 to 10 days to go. The chances of getting the other eye involved are very high. And one of the things you should not be doing is, in the immediate course, unless you're completely medically supervised, is use steroids. I mean, I have received WhatsApp since yesterday, at least 3 or 4 times, from patients who have said that this is what my chemist has given me. in all the cases, it was a steroid drop. That increases the chance of the spread. Also, the patient remains shedding the virus for much longer, therefore becoming somebody who spreads it for a longer duration.
Dr. Sakuja, just picking up on what you said, don't use steroids. You know, it brings us to the part where people tend to self-medicate, especially when it's cases like this, when they're 3 to 4 times more than the usual what we've seen. Dr. Anita Sethi mentioned that this time around, it's taking longer for patients to recover. I'd like to bring in Dr. Sunil Raina at this point. His forte is disease prevention and management. Dr. Raina, now people tend to self-medicate, buy eye drops over the counter. What's your advice to those people? We've heard Dr. Sakuja say stay away from steroids at this point. Besides consulting medical officials and doctors, what is your advice to those who are self-medicating and buying eye drops over the counter?
First, thanks for having me on the show. And this is very important, what we need to communicate to the people. The communication that should go to the general public is that, look, we are having a disease which is not uncommon to happen in this part of the year. So this is the season when we do have conjunctivitis. Does this cause debility of a huge level? It doesn't cause it. It's usually self-limiting. So going to over-the-counter medications and treating it on your own may not be advisable. Generally, if you have the warning symptoms, as the ophthalmologist will tell you, if there are any warning symptoms that necessarily need you to take you to a doctor or seen by a doctor, then only go to a doctor and take medications. Over-the-counter medications are not something which are advisable in a condition which generally is self-limiting.
Right. You know, Dr. Sakuja spoke about the prevention and precautions. Also, any adverse implication of the disease or the treatment, how long does it last? And like Parmeshwar was mentioned, Dr. Sethi was mentioning that it is taking longer than usual for people to heal this time around. Is it because it's been raining continuously and it, you know, even though it's, you know, the monsoon season is on, but apparently we're seeing a rise as far as, you know, the kind of rain we've seen. And when exactly will this epidemic end?
Well, the epidemic is related to the rains. So yes, it is going to last maybe as long as it is raining that hard. But the actual course of the disease this time is just more severe, and it's taking, you know, 7 to 10 days in adults. In children, it seems to be a little milder. But some of the adults really have a lot of swelling, redness, and though it is going to get better in a week or so, but that 7 to 10 days is really uncomfortable. So we do have to give them symptomatic relief. And our main issue is that it should not spread to the front part of the eye, which is called the cornea. This is an infection of the, you know, the conjunctiva. So it shouldn't spread to the cornea because that can have vision-threatening implications. So we basically, as doctors, need to watch out for that. And another reason why the patient should come to a doctor, not go to a chemist, because we do need to make sure that there isn't any secondary infection or a corneal infection.
Right, important advice there from Dr. Sethi. Dr. Sakuja, this time around, are you witnessing that most cases are being reported largely from the younger population?
Maybe, but I've never really looked at it from that point of view, whether it's mostly from the younger population. The younger population is a more mobile population. So that may be the reason why they have greater contact with other people. The older population gets it. I mean, if you're talking about really elderly, will get it because we are giving it to them. All the people who are younger are giving it to them, you know, who have greater contact. I think that would be the reason. Also, younger people tend to have much higher levels of immunity. And, you know, when the virus has invaded the system, the body goes into an overdrive trying to fix it. So the more more aggressive your immune response, the more severe your symptoms. So that may be the reason why.
Right, and also Dr. Sakuja, you know, what is its usual time for, you know, the healing process? How long does that take? About 7 to 10 days? And this time around, how long are we seeing, you know, it's taking for people to heal?
I think 7 to 10 days is a good sort of thing. You know, some people will have a much milder attack, may go off quickly. But I think 7 to 10 days is a fairly good sort of estimate.
Right.
In the majority of cases, it settles on its own. So there's no reason to sort of completely go into panic and think that what's going to happen. But like, as Dr. Raina said, as Dr. Sethi said, I think that in an occasional patient, it does go into the cornea, and then that causes a little bit of visual implications, which also settle over a period of time, over a 6-month period or so. But it's less and less common. And again, I want to emphasize that, by having everything available over the counter, so we just walk in, I want to take what we want. It's obviously much easier. You don't have to go and sit in queue. You do not have to sit and see a doctor. You don't have to pay a doctor. But you can just walk into a chemist and then pick up the medicine. Not a great idea right now, at least.
Right. Let's also ask Dr. Raina, any do's or don'ts, especially for swimmers? How do swimmers protect their eyes from infection?
Primarily, if the swimmer is infected, he or she should avoid going to the swimming pool. That's the best way to do it. The rest of the precautions stay the same as they stay for others who are infected or want to be prevented from the infection itself. So you have to keep washing your hands. You don't need to come into contact with somebody who is having infection. If you have the infection, just take care of these eyes, wash them frequently, use a cotton cloth to clean the eyes. And every time you use a cotton cloth to clean the eyes, throw them off, use a second one. The next time you want to clean it up, wash your hands as frequently as possible. But the key would be, as you said, the swimmers, if he's infected or she is infected, avoid going to the pool. And if he or she picks up the infection from the pool. Now, going to the public spaces, meaning by that, what I mean is that if you are using a common pool, you should issue advisories to the societies wherein the pool is located or the hotels wherein the pool is located, which should strictly issue these advisories to the people that if you are suffering from conjunctivitis, please do not enter our pools.
Right. Thank you so much, Dr. Raina, Dr. Sethi and Dr. Sakuja for joining us today. As discussed, some of the common symptoms to look out for include watery eyes, redness,
just before we wrap,
irritation and
Sethi
swollen
has
eyes
a
as
point
well.
To make.
Yeah.
Yeah, just a quick thing about,
go ahead,
wiping your hands, sharing towels. Virus can be in those secretions in the cloth. So avoid the hankies, avoid the sharing the towels, use tissues which you can just throw. So, the virus does stay on the hankies and the clothes. So that's also an important thing.
Important advice, especially as schools have resumed, ma'am. Thank you so much for joining us with that parting shot.